see scars that really aren't about your skin. It's about emotionally what a toll this has taken on your life. And I know you've seen many doctors, but the reason that Dr. Batra is here today is we actually sent Hannah for a consultation to see her.
I really feel for Hannah's mom. She said that this started when Hannah was 8, and I have an 8-year-old daughter. Just on a personal level, I tremendously sympathize with them, and I hope that we can figure out what's going on. When I first saw Hannah's acne, it was striking. This would be considered severe nodular cystic acne. What's happened is the dermis has been destroyed. I can just tell it was so incredibly inflamed to the point that it's actually eaten up the collagen underneath. While it's not as active on her face, there were still cysts today that were new. When I was examining her arms, it actually seems to be spreading and involving more. Sometimes when you have anything that impacts how you look, it makes you feel so alone. You're not hopeless.
Dr. Batra, you've had the blessing of seeing Hannah, and I know you ran a number of tests. I know you're here for some modicum of hope. What can be done?
So we did run a number of blood tests, and I'm concerned and think that we need to follow up on a couple of them. But I think, you know, as we talked about, you actually aren't using anything for your acne right now. I think it's been such a frustrating process, and you really feel like the things you've used haven't impacted this. And one of the things I wanted to say about coming on the show and talking to you is that this is kind of the very start, even though this has been going on for 6 years and been kind of already a long-standing process. At 14, if you don't do anything for your acne, it's only going to continue. More cysts will come, more scars will come. So I really do want you to get back on a medication regimen, and I will work with you to get one that's really effective in shutting down the cysts especially, which are the most destructive and the most contributing to scarring. This may involve a second course of the isotretinoin or the Accutane, and we would support you with that because I know that mood changes and depression were a big concern. And then because this has already left so many footprints at such a young age, and we're talking about those deeper scars, I definitely think you have hope with laser treatments because we have some really excellent lasers now that can help with the discoloration, that can help with that loss of volume in the skin and with the redness. So I think if we get you back on a really good regimen and we talk about the root cause of the acne and get you on board with some laser treatments, there's definitely hope, and that we can interrupt this process so it's not just going to get worse and worse throughout the rest of your teens.
Do you feel a little hope?
Yes, sir.
Well,
One thing, Travis, that Dr. Batra and I were talking about, which I think is also important for people watching to know, in this age group, it's very important. Ideally, you would have a gynecologist, an adolescent gynecologist, working hand in hand with the dermatologist, because acne in girls or women on the back and chest is oftentimes, almost always, has a hormonal component. And so a lot of times we'll have a spectacular dermatologist like Dr. Batra treat very aggressively what's happening with the skin, and the gynecologist will treat the hormonal cause, which a lot of times is a big, big part of it, especially the refractory acne like this.
and you've been in really good hands. We also reached out to Dr. Thomas Bender of Advanced Dermatology and Skincare Center. Happens to be near your hometown of Pensacola. He's joining us via Skype. And Dr. Bender, I want to welcome you to the show and just ask you, because I know you graciously have come on our show today to continue to give hope to this beautiful young woman. But based on Dr. Batra's recommendations, I know you have a follow-up comment on that.
You know, like Dr. Batra said, we're going to treat you probably 5 or 6 months with isotretinoin, also known as Accutane. And then after that, what we're going to do is we're going to give you at least 10 laser treatments as a courtesy, so free of charge.
I don't know if you can see Hannah's face, but you put a big smile on it. So you'll be seeing a lot of Dr. Bender, but we're also going to send you to Ashley Pennywell of A Clean Mind Coaching and Counseling, because a lot of what you're dealing with, we know it's the emotional hardships that this has all led to, because we want to make you whole. We want to make you whole and happy and get out there in the world and live your life because you deserve it.